So it's so funny. Everybody, has asked us, why is BALLE in the healthcare sector? How did we move in this direction? And really the conversation, I think, is around why is the healthcare sector so engaged in the community and economic development space?
Yeah, and the healthcare sector, which of course delivers care, is only a small part of what creates health, and recognizing that most of what creates health in the community has caused us to come towards BALLE as an organization that knows how to build equitable prosperity and economic development in communities in a way that actually not only creates opportunity for people, but that actually improves health in the first place.
And it's, and it's interesting, I think, as, we've kind of been involving our work and seeing that same trajectory with the healthcare sector, there's really been this shift in recognizing that 80% of the health is actually not determined by clinical care.
Right.
That it has to do with what is going on based on, people's social determinants of health.
Well, and the timing around that is so important because historically, most of the $3 trillion health sector has been reimbursed for more and more treatment, essentially volume of care. And with the Affordable Care Act, the incentives are shifting to where healthcare organizations are getting global payments or at-risk arrangements where rather than benefiting from more volume of illness treatment, they are actually going at risk for improving health. And so it's causing healthcare organizations to say, how do I address the other 80%, which of course is in housing and transportation and access to healthy food and home care and all of the things that BALLE actually looks at from building a strong local equitable economy.
Yeah, I was pretty blown away when I was talking to one of the healthcare providers at a gathering of all the different institutions, and kind of the phrase there was that, rather than looking at the genetic code as a determinant of health, they're looking at zip codes as the determinant of health. And I think that's what was really opportune when we connected, as we had kind of finalized our local economy framework, and we looked at each of those 8 different strategies. And you're like, wait a minute, those perfectly line up with addressing the social determinants of health. And so that's when we created this field guide, which I think first was really, when we developed it, was for the healthcare sector to say, look, here's why it's relevant to focus on local and economic development, and here are some strategies. But it's also been a really good leverage point for all the grassroots and community-based organizations to say, here's why it's meaningful to work with us. So we are seeing the value of these alliances building up in the community.
It's right. It's such an amazing time for us to be creating the bridge that the local field guide actually does, because it's framing the conversation around what matters to community economic development and what matters to healthcare, so that the issues are there. And there's been an understanding of this, but how do you begin these conversations? What does it mean to localize procurement? What does it mean to use an investment portfolio in a way that drives the local economy? What does it mean to design and build health facilities in a way that creates place? How do we hire differently in a way that allows jobs to be created from the most vulnerable communities? And I think we all have a lot to learn around that. The field guide in BALLE's work is really helping healthcare look at how to move, but it's creating a platform for a conversation that people of different perspectives and frankly different North Stars, improving health, improving economic development, can actually find common language.
And we're really seeing people light up, I would say, in the field when we have these conversations. Looking at when we were at SOCAP and the session that we did, and just even the framing around how really the healthcare providers are the purchasers of health, while the community is the producers of health.
Yes.
What is say?
Well, it's fascinating. In a marketplace that values health, where we know we produce only 10 to 20% at best, and as you're saying, a community actually produces health, then we need to look at how we're increasingly using our dollars to purchase that, and to look at the community collaborative entities as the intermediaries to help us do that. That's a 180-degree shift in the way we've thought about it, which is healthcare creates health, and the community essentially needs to purchase that. So it's a really important moment for what we might call value creation for healthcare, where we're actually lifting up improved health, improved prosperity in the community as the driver of what creates health.
Yeah.
So as a healthcare organization that's part of a sector that drives $3 trillion, or 18% of the economy, we're now seeing community-based organizations that support housing, that grow healthy foods, that great mobility, there's job creation, education, early childhood. That's what actually creates health, and we need to purchase that.